as a clinician, maybe I feel that it's something that's very commonly observed and seen, and majorly the actual genuine problems that are there, they stay there for long because we keep staying in denial, or we keep pushing it away, that okay, no, this is normal, oh, this is okay. And we as a community also approach to the everyday struggles in a manner that okay, we need to empower the other person should have a certain level of coping to deal with the crisis. But what happens is that we do not understand a lot of times that the problem may be slightly more severe, or the problem might be a little more problematic. So this is one aspect to it. However, if such is the case that the problem is a problem and it's a clinical disorder, we need to identify whether I am functional or dysfunctional. If you are not functioning in your personal, occupational, or professional life, that means that it requires certain level of attention. If it is disrupting your quality of life, maybe a simple headache, or a simple symptom of fatigue, or pain in legs, or just aches and pains, so that means that we should look into the quality of life and at least come up with a regime that can manage and help in a certain manner that's really empowering. However, a lot of times it is not the problem that is the problem. We tend to push the everyday things also into the category of a disorder or a problem. We all have a natural tendency to experience the highs and lows. Now what happens is that how many of us, there are days that when we wake up and we don't feel like going to work, we don't feel like talking to anyone, we don't feel like eating the same breakfast as we ate yesterday or we have been eating for years or months. It is because we all require a restoration period. I usually call it a restoration period because in this you don't even require any sort of intervention. Rather, you are able to deal with it in a manner that it automatically diffuses over days and times, and then you start gathering the same energy even with a booster form, like even in a form that's more energetic, more focused, more clear-headed. So what happens is that whenever there is a low episode, we give it some time. We try that these episodes are not very recurrent, they're not very frequent, but whenever it is there, whenever there is some crisis situation, we let it sink in, we take some time, because a lot of times we are just pulling ourselves, dragging ourselves, or we are just trying to manage the chaos that's there in the life. We have busy work life, we have busy home routines, we have kids to look after, we have parents to take care of, we have work related commitments to fulfill. But what happens is that then there are days that are free. So the mind understands and picks the days that are of the void. So first we do monitor that okay, such episodes, do they come in on days that are free, or they barge in, and then they make sure that we put aside all the commitments. It's rare that on a very important day you would be very low. It is because the body automatically gets you into the adrenaline rush, and the body responds very cooperatively to whatever the mind wants and to how the mind wants to deal with the situation or the event or the consequence. But a lot of times it comes in on a Sunday, it starts from a Sunday, and then it continues from Monday, and we call them Monday blues and Tuesdays and this and that. However, this may not be a regular case, right? So if any of us experience any sort of a low mood, fatigue, low energy on maybe on a Sunday, Monday, or even in the middle of the week, we can always give it some time to settle in, and you will see and note yourself feeling better and comfortable. So let us not push everything into a clinical disorder or a depression, but maybe look into these and take it as a booster dose, that this is going to restore me. That's my day of ensuring, or maybe that's my day of fulfilling whatever was missing and spending time with myself. So the clutter just settles in, we organize ourselves, and we are able to function better.